So SpRRIC was set up in response to trainees' concerns about getting involved in research. They said it was very difficult to do and that it could be time consuming and sometimes it wasn't very productive in terms of what they got out at the end of it. So we set up SpRRIC, or the SpRRIC Research Involvement Course, to try and get psychiatry trainees into active research quickly and easily. So there's two aspects to SpRRIC. The first one is that you're placed with an active research team with a named clinical studies officer who acts as your lead and mentor. So you join the active research team and you become really involved in the recruitment, doing the data gathering, telling people about studies, advertising studies, and perhaps even analysing some of the data if that's appropriate. So that's one side of SpRRIC. The other side is that we run an educational programme that goes alongside that, where everybody on the course gets together and we have outside speakers come and teach us about various aspects of research. So, for example, how to get an application through ethics, thinking about informed consent, thinking about how to do literature reviews, systematic analysis, to increase the knowledge overall about research practices, so that hopefully by the end of the course you've got a load of really useful clinical experience, actual experience in research, as well as some theoretical knowledge that you can put together to hopefully be involved in research in the future.
So I did the SpRRIC course in my advanced training, in the middle year of my advanced training, and I worked on two different projects as part of SpRRIC. I'm a learning disability psychiatrist, and I was able to work on projects that worked with people with learning disability, which was particularly useful for me. It really had a big impact on my ability to understand how research fitted in. And how you didn't have to be a researcher or a clinician, but you could do bits of both. I think one of the most exciting things for me was getting to actually do stuff and beginning to believe that I could do this. I think I'd always felt quite intimidated by the world of research, that it felt like it was a different language, and that this was mostly done by people who were highly academic and understood all of these things. And it was quite exciting to be able to do things, to prove to myself I was able to do that, to learn from experts, and to be able to see the actual benefits for my patients, and to be able to work out how I could integrate bits of research into a clinical role. It was really useful when doing applications for my consultant post and the interview for a consultant post, which I think can be quite daunting, and it's really nice to be able to put things in all the boxes and have examples of how you've learnt and what you can offer to a trust when you come for a consultant interview.
SpRRIC is about getting the speciality ST4 to 6 doctors involved in research projects, giving them opportunities and allowing other bits of the organisation to benefit from their enthusiasm, ability, knowledge, etc.
So I did SpRRIC in my first senior training year, and it sounded really good. It sounded really well thought out, sounded really structured, which kind of appealed to me. I really liked the idea of kind of getting involved in research in the day-to-day kind of clinical sense, if you like, whereas before I think I'd always thought was research something you kind of did maybe away from, the clinic and what have you. So it just really appeals.
It was really interesting to be involved with clinical trials of drug companies, because there's so much kind of controversy around medication psychiatry and research and the drug companies and things like that. So to see what that's like from the inside, how that research is done, was really informative. I was working at Kings Hill Research Centre on a number of clinical trials looking at treatments for dementia, hopefully trying to actually treat the underlying cause of the brain deterioration. Benefits for me of being involved with SpRRIC, I think mainly would be in future I'd be much less cautious about involving my own patients in clinical research. I'd be much more inclined to discuss it with them, ask if they were interested, and make sure they had the opportunity if it's something they wanted to do. I think it's been useful, as a non-academic, doing SpRRIC has been useful as a kind of entry-level experience of being a medic involved in clinical research. If there were opportunities in the future to get more involved, even to be a principal investigator or something, I would be much more. I wouldn't see it as a scary thing or a thing that was impossible. I'd be much more comfortable with thinking about taking it on and giving it a go.
Well, it's good for them because they get involved in research. That's one of the things they need to do in order to progress in their career, and it's part of their training. It's important for us in the organisation and in Bristol, in my case, as we get opportunity for them to help out with various research projects that we've got going.
I was quite lucky. One of the clinical trials Kings Hill Research Centre was doing into a treatment on dementia required me to go to a investigators meeting in Rome for a couple of days, which was very unusual, not the kind of thing I would do in my normal work. So that was a bit of a treat.
We really encourage people to get involved in research because as clinicians you can make a massive contribution to what we know about psychiatric disorders and the help we can give our patients in the future. So SpRRIC enables people to meet those competencies in terms of their ARC-P and passing the requirements set down by the Royal College of Psychiatrists for research. But more than that, it's about getting them enthused about doing research in the NHS and enabling them to form those links with the professionals that we have here in this area that can really get them in doing things straight off without all the difficulties that can come with setting up your own research. So you get involved in an active research team, you've got a role, you are a real benefit to that team, and you're building those relationships that we hope will be sort of career long so that you continue to be involved in research throughout your career in the NHS. I think research is key to what we do as doctors because without research we can't provide the best evidence, most effective treatments for our patients. And so getting involved with research is as much about being as a good doctor as actually sitting down and doing your clinical work.
It's what needs to drive clinical practice really. I think we're very much in the world of evidence-based practice. We need to be demonstrating that to our commissioners and what have you. So I think we need to have that research basis. I think for me as well, now that I'm in a consultant role, I would look to be a trainer for trainees. I think it's important that I have that understanding of the research process to support trainees. So I think it's going to be helping, develop medics of the future.
And I guess part of it's around a sense that if in the NHS we're not involved in research, we're not improving things for patients. So
one of the main reasons that research is important is to guide future changes in care. So, obviously you could change care without research, but you're kind of working in the dark, aren't you, and just hoping things go well. Whereas if you've got real research guiding what interventions may or may not help, then things will hopefully get better quicker. And clearly, we're not going to get any new treatments without research.
Because I work with people with learning disability or autism spectrum disorders, it's a group where there's a lack of good research and that often this patient group is excluded from mainstream studies and we just don't have the information that we need. So on a sort of day-to-day basis, I often reach for the evidence and find that there isn't any. And that's hard in making decisions around what would be the best treatments for our patients and also in how to explain to patients and their families why we're recommending one thing over another.
Normally in psychiatry we're working with people when everything's falling apart or things aren't working or they're getting complications and side effects or treatments aren't working anymore and things like that. So it's quite nice to work with people who are otherwise well and talk to them about how they're managing. I think you learn a lot more about the condition that you don't necessarily see in routine clinical practice.
good for doctors and good for patients.
The SpRRIC Research Involvement Course.
SpRRIC Research Involvement Course.
What does SpRRIC stand for? Is this a test? SpRRIC Research Involvement Course.